Hello, and welcome to another episode of Health Matters. My name is Dr. Michael Chillemi, and today I'm going to be taking you through a journey of demystifying sciatica. We're going to understand the symptoms, the causes, and the treatment options. In today's episode, understanding sciatica is such an important topic because it's a condition that affects millions of adults at some point in their lives. Pretty much anybody you know at some point in their life had some form of sciatica. So we're going to dive into the latest medical knowledge. We're going to try to give you this knowledge to have you have a better, happier, healthier, and pain-free life. So we're going to really break down the symptoms, causes, diagnosis, treatment options, from non-invasive treatment options to medical interventions. Our goal is to provide you with comprehensive information that can guide you towards effective, pain-free lifestyle, right? Okay, so what is sciatica? The term sciatica, ooh, big scary term. No, sciatica is referring to pain that is along the path of the sciatic nerve. The sciatic nerve branches from your lower back, goes through your buttocks, into your hip, and down your leg. Typically, sciatica affects one side of your body. Sciatica is typically caused by a herniated disc, a bone spur, or narrowing of the spine, which is called spinal stenosis. That's compressing part of that nerve. That's what that is. So when you compress part of a nerve, this causes inflammation, pain, and numbness along that leg. Sciatica is generally considered a condition rather than a diagnosis. So what that means is when someone says, oh, I have sciatica, that's not a diagnosis. That's really a condition. So the diagnosis would be, I have a herniated disc. That disc has sciatica symptoms. Or I have spinal stenosis. The spinal stenosis is now causing a sciatica symptom. It's the condition of. It's not a diagnosis of. And I think a lot of people confuse it. And I really wanted to make sure we understand that it is a condition. So sciatica, the term, is used to really describe the set of symptoms resulting from the underlying medical condition that compresses or irritates the sciatic nerve. That's the simple version, right? So part of that sciatic nerve is compressed somewhere, and now it's going down your leg. Sciatica typically denotes the presence of that nerve or the nerve root being compressed. The most likely cause is a select few. So there's not a ton of diagnoses that do that. All right, let's break down the symptoms of sciatica and how do we differentiate this from other conditions. So sciatica symptoms can range from mild to severe, and they typically affect the lower back. So often sciatica starts in the lower back and then radiates down the buttocks into the leg. And again, the pain can be from mild to sharp stabbing, where I can't move, or even burning sensation. Some patients can describe it as a jolt or electric shock. Typically, you're going to have symptoms that are in the buttocks and leg pain, aka radiating pain. That is typically the hallmark sign of sciatica. It originates in your lower spine and spreads down the back of your leg The burning or the radiating or the numbing pain is typically what you're going to feel. You can have hip pain. Hip pain can extend from your lower back into your hip, so it can come down and around. There's other symptoms that you can feel are tingling sensations, tingling, pins and needles. They can be constant or they can come and go. You can also have numbness or weakness. When you're affecting that nerve or pathway, you can feel the tingling or numbness in your lower extremity. You can feel it in your foot. Usually, again, it's one side. So you're going to feel that pain on one side, and it can start at the top and go straight down, or sometimes you can feel it just in the lower part of your leg. But usually, it's associated as going straight down. Prolonged sitting usually makes it worse because you can compress the nerve as you're sitting. Other symptoms include movement makes it worse. So when you move, you get the sharp stabbing pain. You can move from standing to sitting or sitting to standing, or sudden movements like coughing or sneezing. That can make the pain even worse. Okay, so now you understand some of the symptoms. Let's go over what are the causes of sciatica. Various conditions cause irritation or compression of a sciatic nerve, leading to the symptoms. The most common causes are herniated discs, which is the most common cause. Discs that sit between, so you have the disc that sit between the vertebrae. When they bulge out or rupture, they can put pressure on the nerve. To get some more information on that, listen to my last video on herniated discs. I went over that in complete detail. But when you're compressing that nerve and you're compressing the sciatic nerve, you're going to get those type of symptoms. Next is spinal stenosis. That's a condition when the narrowing of your spine, the narrowing of where your nerve comes out, is compressed. And part of the nerve is being compressed. So I want you to think of if your nerve is a hole, your nerve canal is a hole like this, right? And let's say you have, I'm going to use my pen as your nerve. This is your nerve. When you have spinal stenosis, what that means is instead of the hole being this big, now maybe the hole is this big. So now the space that you have for that nerve to operate is much smaller. So slight irritations might compress it. There are times when stenosis gets so bad, it closes down the hole and you are compressing on that nerve completely. So variations of your level of stenosis will affect if you have sciatica or not. And coming soon will be a video on spinal stenosis. You knew that was coming, right? Okay. So the next condition that can cause sciatica is bone spurs. So overgrowth of bones in your vertebrae can encroach or move into the areas where your nerves are, and that can compress it. So I want you to think of that like if you had a tree. I'm looking at my tree behind me, but it's not really big enough for me to show you. If you had a tree and part of that main branch, all right, I can do it like this. So if this is your root of your tree, and this is the disc on top of it, what can happen is you can bulge out, right? So that instead of the discs, the bones being flat, you can have irritations that come out where it's overgrown, right? So now it's overgrown, it's hooking out. When that hooks out or comes out, you can dig into your nerves and put pressure, and that can cause pain, sciatic type pain. Another condition that can cause sciatica is piriformis syndrome. So piriformis is a muscle that is in your buttocks. So if your buttocks is here, you're going to have the sciatic nerve that comes straight down, but your piriformis muscle is right in the middle of your glutes. And what happens is, as that muscle gets irritated, it clamps down on that nerve. And if it does that, it can cause sciatic symptoms down your leg. Why? Because the nerve is here, your muscle is here, the muscle gets irritated, jabs down on the nerve, and it puts pressure straight down your leg. That's typically piriformis syndrome. That is one of the bigger ones to try to differentiate when you don't have a herniated disc type injury or a bulge injury. It is a very common condition, especially in people who work out, to irritate that nerve. Another condition that can cause sciatic type pain is spondylolisthesis. So spondylolisthesis is if you have two bones and one of the bones either moves forward or backwards, right? Anterolisthesis means the bones move forward. Retrolisthesis means the bones move backwards. When it does that, it typically causes nerve compression. Spoiler alert, spondylolisthesis will be another topic I'll be talking about coming soon. Other areas that can cause sciatic type pain is injuries or trauma. Any physical trauma or significant injury to the lumbar spine can cause sciatic type symptoms. Okay, so now you understand the conditions. How do we diagnose it? So typically diagnosing sciatica involves a thorough review of your medical history, obviously, finding out all your symptoms, doing a complete and thorough physical examination. Your exam should include range of motion testing, muscle testing, neurological testing, orthopedic testing. You might be asked to walk on your toes, walk on your heels, get up from sitting or standing, try to stand on one leg at a time, and a variety of other tasks to identify your physical limitations. Imaging is usually performed. With that, it could either be x-rays or MRIs or CT scans. So typically, if we're going to look at x-rays, we're going to look for bone spurs, right? So like we talked about, if any of those bones are coming out and we're hooking, we're going to look for, make sure we don't have any of those. For the MRIs or CT scans, more for the MRIs, we're going to look for those herniated discs, because the herniated disc will be identified through MRI. That's typically the only way to tell if you have a herniated disc, right? So I can, through my physical exam and through my history, I could determine what's going on. Do I think you have a herniated disc or not? Do I think it could be herniated? If I say herniated, it could be herniated or bulge, right? So I don't know. Based on symptomatology, I could take an x-ray, I could see space, right? So if I have two discs, here like this, right, and I have a big giant space, I can assume there's a lot of space in there and it might not be compressed. But if I have x-rays and I see my space is very, very much compressed, I can assume your space is less. And in theory, you might be compressing the nerve. That would indicate sciatica symptoms and decrease in joint space that would lead me to wanting to have an MRI to see if we do have a compression or not, right? So the MRI really is the defining factor to say, yes, you do or you don't. Other ways to determine if you have sciatica is you could do a nerve test, such as an EMG, electromyograph. That checks the electrical impulses from your sciatic nerve, well, from your nervous system. So an EMG, typically you do an EMG NCV, which will check the nerve conduction velocity as well as the nerve senses from your spine all the way down your leg. Right, so that'll be one of the ways you could actually diagnose it. So that's really the way to diagnose sciatica. But I got great news for you guys. Many non-invasive treatments can help with sciatica. Especially in my office at the Health and Spine Wellness Center, we offer a variety of treatments to alleviate sciatica type symptoms. First thing we typically do, we want to look at non-invasive treatments, and we're going to obviously look at chiropractic care, through our adjustments, through the different therapies that we utilize. whether we're doing electric stimulation, mechanical traction, full spinal traction. And when we say spinal traction means you're actually stretching part of your spine, right? Try to take the pressure off your spine. And we have a few different varieties of different tractions you typically do for that. Do some exercises in there. Typically works very, very well for many, many patients. We also like to incorporate physical therapy with that. When we're incorporating physical therapy, we're doing exercises and stretches to help improve your posture and strengthen your muscles that are supporting your spine, increasing your flexibility. When we're doing those stretching exercises, they're targeting the lower back and hamstrings to relieve pressure. When they're doing the strength training, they're going to strengthen the muscles that support your spine to prevent further issues, as well as to try to heal the tissues that are there now. Other conservative care, you could do acupuncture at specific points to help with pain. We could do massage therapy. When you do deep massage therapy, helps release tight muscles and improves blood circulation. You could do hot and cold therapy to decrease pain and inflammation. Typically, the more blood flow you get to the area, the more the muscle's going to loosen up. Once the muscle loosens up a little, you're going to be able to stretch more. If we're talking now from non-invasive to other therapies, medications, so typically in other offices, you could do medications. You could do over-the-counter drugs like ibuprofen, aspirin, or acetaminophen, or any anti-inflammatories to help reduce any kind of nerve inflammation. If we're talking about lifestyle changes, you would want to work on increasing your exercises, low impact, walking, swimming, yoga, trying to keep your spine healthy. You want to have ergonomic adjustments, making sure you're using good seating, right? Make sure when you're doing your exercises, you're doing proper posture. There are a lot of times that non-invasive treatments are helpful, but there are times where patients do need medical intervention. So if your signs and symptoms, or you have significant muscle loss, significant weakness, bowel control, bladder control, that's an immediate medical professional to go see, right? That's a straight out to the hospital go see, right? In the medical community, they have a variety of different treatments. Treatments can include prescription medications, much stronger than the NSAIDs that you can buy over the counter. They also can do epidural steroid injections that can help temporarily reduce inflammation around the irritated nerve. They can do surgery, typically done obviously as a last resort, but there are times where it is necessary when you have that considerable leg weakness or the bowel or bladder control and your condition is beyond a non-invasive condition, right? Not every condition is that basic, but there are times where you do have to have surgery, and that could be a microdiscectomy, a laminectomy, or a variety of other types of surgeries out there. So there's really not a ton more of information on sciatica, to be quite honest with you. There are other conditions, right? So you'll see in upcoming events, upcoming podcasts that we'll talk about piriformis syndrome, we'll talk about spondylolisthesis, and we'll break those down into detail, and you'll have a much better understanding of what those are. We already spoke about in my previous video herniated discs, so that went into a bunch of those categories. So I really wanted to break the myth of sciatica as a the diagnosis and the sciatica as the condition, right? So you understand a lot of different things can cause sciatica type pain. And it's important to understand what your symptoms are and how to get treated. So hopefully I gave you a little bit of a deep dive into the world of sciatica. I know I deal with it every single day in my office. It's part of our practice that we do every single day. I hope I gave you some good information for you to understand it and let you know there is definitely hope if you have sciatica. From simple lifestyle changes to professional treatments, whether it's at my facility or a facility similar to mine or at another medical facility. Remember, you do not have to endure pain alone. Consult with a professional. Be proactive with your care. The earlier you start your treatment, the better you'll feel. Right. So in my office, we're an integrated medical office, and we're committed to finding the root cause of your pain, not just the symptoms, right? So we don't want to fix just your symptom. We rather fix the problem. Like, for example, if you have a car engine that is making a funny sound, I can put that mystery oil in that they sell. Oh, it goes away. But guess what? It comes back. And maybe it's worse, right? So it's not the sound that's making the problem. You want to fix what the problem is, right? So, oh, maybe in that example, maybe you have a bad engine, but now you just masked the problem by taking medications or doing different things where your problem hasn't gone away. You just kick the can per se down the road because you've made yourself feel better temporarily or a short period of time by taking certain things. And sometimes you need to take them. I'm not telling you to take them or not to take them. That is definitely up to you. I'm just saying when in our office, we go a little bit deeper. We want to find out why you're having it and how do we fix that, right? How do we treat that? Whether that's doing the combination of all the different services that we do and then trying to build you back up stronger, better, right? That's what we try to do. We try to fix the root so you can grow and be stronger. Dealing with sciatica can be very, very frustrating and very debilitating for a lot of patients. It's important for you to look for solutions that are the most up to date with rehab technology, regeneration medicine, physical therapy, chiropractic. All of that is stuff we do in our office. If you're really in pain, make sure you do talk to somebody. You want to live a pain-free, active life. That is the goal. That's the goal of when you come see us and what we do. Our goal is to always make sure that you're living life and not just existing in life, right? So a lot of times people live life and they're existing. They're there, but they're not there, right? You can't do this, you can't do that. You make excuses and denials of different things. I can't go to the gym this or that reason, or I can't take a walk for this far, or I can't go to the family event because we got to park 4 blocks away and I can't walk that, or it's a block away and I can't walk that, or it's up a flight of stairs and I can't do that. All these things that we all do in our lives and we say we can't do, those are things that at some point you have to try to live life, right? So get out of pain, get functional, right? The goal is function. Everything in life is function. Everything in life is function. Maybe that's just me because I'm kind of a function guy. Um, I've always been function. It's always started with I went to school in Kansas City for a short period of time, and their license plate always said it's the show me state. So function to me is the show me, right? Show me what you can do, show me what you can't do. And to me, that's the important part in life. I want to be the show me. And I think for you, and I'm speaking to you, because whether it's you, your brother, your sister, your uncle, your mother, your father, you know somebody that has this condition. I 100% guarantee it. And life is too short to just be there, be present, be active. Don't sit on the sidelines and say, wish I could have, should have, right? It's crazy, but I have patients that are young, 40s, 50s, and 60s that are existing and not living because they have this, that, or the other thing. And they rather stay in the back, stay on the sidelines than trying to be active. And I get it. Certain conditions, you're limited. I understand. I am not saying that, you know what, if you have certain conditions, you definitely have limitations. I'm not naive to that, of course, but we got to be as present as we can. A lot of times there's a lot more we can give and do. We choose to sit on the sidelines for a lot of things, right? So everything's an active choice. So like for me, I actively choose to get up at 5:30 in the morning so I can go exercise. Because if I don't, then I don't have the time. I don't like to get up at 5:30. It's not my thing. I rather get up at 7:30 and enjoy those extra hours of sleep. But if I don't do it, I won't have that exercise. I won't have that energy boost. For me, that's what I need. So I push to do it. Whether I want to or not, I do. Because I want to be present, right? So as you live life and as you age, you tend to understand things better and better, and you want to be present longer and longer and be functional. And I'll speak to patients that are between 50 and 75. You want to be active in your golden years. I have so many patients that I know in their golden 60s and golden 70s, and they really can't do much, right? So it's not really golden, right? They let all those other years that they were not doing things, giving things up, sacrificing, but now they let their health deplete, and now they can't do things. Don't let that be you. Sorry, I got off to a tangent. I know. Okay. The tangent is, I guess I'll wrap it up by saying, be active, be conscious, be part of your own health. Because at the end of the day, it's your life. Be healthy. Because as I always say, health matters. And as I always say, these are my opinions. This is not medical advice. Any opinions expressed in here are mine and mine alone. If you have any problems with sciatica, please go see a professional. If you know anybody that this can help, please tell them. See us on Speaker, YouTube, Facebook, X, Instagram. You never know that one person that you could send something to and one little thing can help them. If one part of what I do say can help you or somebody you know, it's all worth it, right? All we're here is to do is to help people. So if we can help you in any way, or if this can help somebody, please pass it. Be well, be healthy. Your health matters. Till next time.